What is the health journey for a woman throughout in her life? What are the kind of key concerns that they face throughout?
Because of the decrease in hormone levels, they go through a lot of mood changes. Could be feeling low in mood or episodes of depression in some of them, or some of them will be very anxious. In fact, many a times it is the husbands who come to my clinic who talk about their wives reacting abnormally, and they know for sure she's going to get her menstrual.
There are like women reporting saying that after I went off these pills, I feel much better and more active and brighter essentially.
That's a myth actually. Contraceptive pills or the regular birth control pills, you get them these days in very minimal dose. The side effects have been minimalized with these low dose pills, and they have a lot of beneficial effects on the general health of the women. The cycle transition happens so smooth, so absolutely no mood swings, no premenstrual syndrome. And during menses, she'll have significantly less blood flow, no cramp. If you have irregular cycles, it will completely normalize your cycles.
Hey guys, I'm Tarun. I'm co-founder of Orange Health Labs, and welcome to the Orange Club podcast. Here we are going to talk about all matters around health, and we're going to make it easy to understand and even easier to act upon. Today we have Dr. Usha B.R. with us. She's a renowned gynecologist and been practicing for the last 20 years. She's an MBBS, MS, and a DNB. We're super proud to have her with us on this episode. Thank you, doctor, for joining us for this episode of the Orange Club.
Hi, Tarun. It's my pleasure to join the Orange Club now.
Great. So, doctor, I was thinking we will just talk about the life cycle of a woman, starting from early years till like late 50s, when one is a mature woman, right? How does what is the health journey for a woman throughout in her life, and what are the kind of key concerns that they face throughout? So it would be good, there are a lot of conversations that happen online. There are a lot of myths that float about. So, this episode is, and this podcast is essentially about having experts and doctors come over here and just give us a very knowledgeable view on some of these questions instead of just going online and searching, get a sensible answer.
It's always
for the
better to
questions.
ask the expert.
Yeah, absolutely. So great to have you. I'm super excited. I know a lot of parents who have young girls. I'm sure they would benefit greatly from this discussion. And just starting from the parenthood side, the first, initially children are all children. I think the first signs of girlhood and then going towards womanhood start with the onset of puberty. And generally, what is the age that one expects puberty to onset in girls?
So that's a good question to start with. Onset of puberty would start as early as 6 years of age
Oh,
in young girls. So we see changes happening, or in some of them, it could take up to 9 to 10 years also. And it will go on for almost up to 14 to 15 years. Now, what are the changes that we see around puberty? It starts with breast budding in most of the girls. You see that the girl is growing in weight, body mass index, and the breast enlargement, and the nipple also enlarges. Along with this, we see growth spurt happening in girls, which is followed by growth spurt, which happens over the next few years. And then you see body hair increasing, hair in the axil or the armpit increasing, and in the private parts, you see appearance of pubic hair. And then it ends with menarche, what we call as the onset of menses. The average in Indian girls these days is roughly about 9 to 14 years. Before 8 years, we call it premature onset of menarche. And of course, we wait up to 15 to 16 years. If they have not attained menses even by 16 years, we have to investigate. So that is what we call as primary amenorrhea, where she's not attained menses, and that has to be investigated.
great. Is it? I mean, you mentioned the age of as early as 6 years. I mean, has it always been the case, or is it something that in the modern world we're seeing a certain decrease in age happening? And generally, what is the medical consensus around this? Like, is this what are
The
the reasons for it?
So the age of pubertal changes or the age of menarche is mainly decided by the body mass in the girl. or most importantly, the fat mass in the girl. Now you see that off late in the modern lifestyle that we have, most of the kids these days have more junk food and more fat content in the food, more fructose content in the food. So this happens to increase the fat mass in their body. In fact, we say that a critical mass of fat should be there in the body for her to go through these pubertal changes. Because the fat mass is a little more in these girls, they are going through these changes a little more prematurely, and we're seeing that the age of menarche as early as 9 years, 8 years, and all that these days. This was not something very common probably 2 3 decades back, something which we're seeing off late in the last 2 decades.
Hmm. So, I mean, one of courses would be like to make sure that the children have a good diet and lifestyle and they're active. But let's say, girls as young as 9, 10, or around that age are going through these changes. Like, what would be your advice to these girls or to their parents on how to manage this transition better for
Yeah,
children?
so it is important for mothers and even father to know about this in the family, and essentially they should educate the girl. So many of them in their families consider this as a taboo, not to be spoken about kind of a thing. But yes, they should speak about the changes that the girl should go through or would go through in the next few years, because if it is spoken about openly in the family, the girl also will feel comfortable to discuss things. And many a times I see girls, so hesitant to talk to even their mother and father, and they don't express it at all. But many a times I also see father taking care of her daughter completely. He's the one bringing her for gynecological checkups and all that. So slowly, yes, things should change, and parents should be aware that they should start educating their kids from 6 7 years onwards, that these are the changes that you may go through. Many of them come with just chest pain to me.
Hmm.
That will be actually because of the breast enlargement.
Hmm.
So there'll be small girls. They should be they should be told that, see, these are the changes that you would normally expect, and you should just express it, and it can be taken care of.
Do you, so that's a good point, right? Like some of them come with you with chest pain and all. I mean, that's partly because they were not informed earlier. But at this stage in life, this early, right? Do you recommend that parents should like make a trip to the gynecologist like at any point in time or have a conversation with the gynecologist?
It would actually mean, sometimes putting the girl under, what do you say? It's a little delicate situation also to be discussed. So I would say when there is an issue, the girl should be comfortable enough to express it with her mom or father,
Hmm.
so that they bring her. Usually, a gynecologist checkup would be recommended for a young girl when there are infections,
Okay.
especially those young girls develop urinary infections sometimes, or white discharge or pelvic infection sometimes, which because they don't express go untreated. And sometimes we see that they manifest as pelvic abscesses. They develop abscess in the pelvis inside the abdomen because the pelvic infection or the urinary infection was not treated at all.
And this is because of bad hygiene.
Yes, bad hygiene.
Hmm.
So sometimes girls have leaking of urine,
Hmm.
which they don't get treated or they don't express. They feel that they are unhygienic, they should not be talking about it. So the more you talk about it, the more you express to your parents, I mean, you will be getting treated and you will solve your problem. These kinds of things, should be spoken to girls.
Hmm.
And especially hygiene around menses,
Hmm.
usage of pads, or, the fact that it is not a taboo in the family. Once those things are made clear to the girls, girls will not shy away from expressing things.
So one of the things, and during the research came up was that um, one of the reasons to you might want to consider a visit early on is for getting an HPV vaccine before the menses starts around the age of 10 or 9. I think
Yeah,
CDC mentions
yeah,
9.
it's 9 years.
So, I mean, this is like one more vaccine that has been now added to the series of vaccines that we do to children. And there has been a lot of discussion about this online also. So, just very briefly, like, what is HPV exactly, and why has this suddenly become such a big concern for everyone right now?
HPV is human papilloma virus. Now there is a cancer which is called cervical cancer, which is seen in the mouth of the uterus. That is what we call as cervix. Now cervical cancer burden all over the world is less when it compares to India, because India happens to be the hub for this disease. Among the total disease burden seen all over the world, India is the main hub. All the main cancer burden is in India, especially with respect to cervical cancer. It is the second most common cancer in Indian women these days. And it is a
After breast cancer.
yeah, after breast cancer. So, and it is a completely preventable disease with two preventive strategies. One of them is vaccine. Now, this vaccine is against a virus called human papilloma virus. So, that is the HPV vaccine that we talk about. And this vaccine can protect against that viral infection, which is known to cause cervical cancer in 96% of cases. Another 3 to 4% cases can happen without the infection also, but that is a rarity. So, if you know that there is a disease which is very commonly seen and there is a preventive strategy which you can adopt very young in life itself, I think all of us should adopt. See, because in UK, US, or in European countries, that for that matter, all the kids are getting vaccinated at a very young age.
For HPV.
Yes, for HPV. It is part of their immunization programs in school. So, kids as early as 9 years of age, they get vaccinated. So, that means they are not going to develop this disease. So, the disease burden is significantly lesser there. Here, because of the costing and lack of awareness about the vaccine, see, everybody spends so much about, their kids' health and kids, what is that, immunization, nutrition, schooling. They're spending so much. Okay, but you know that there is one disease which your daughter can get in the long future, but I can do something about it now by giving vaccine to her. I would definitely do it, isn't it?
So it's a complete safe vaccine to take.
Yes, it is a completely safe vaccine.
Okay. So that's great. So then moving on from onset of puberty to like teenage years for children, right? One of the things that is often seen these days is like a lot of teenagers might suffer with an kind of like an irregular length of periods, and that might be kind of concerning, right? So what is really meant by a normal cycle, essentially, first?
Okay. So, irregular menses is something which most of the girls at some point of time in their life will go through. So, it is important to know the length of the cycle. Anything between 21 to 35 days is considered normal.
Okay.
So, some of them are
So people
worried.
have very like strict definition around 28 actually.
Yeah. So, 28 is a very idealistic number. Not
Okay.
everybody will have it around that. 21 to 35 days is normal. Some of them have cycles longer than 35, which is abnormal, or lesser than 21 is also abnormal.
Okay.
So each one's body is different. So each one's cycle also will be different. Most of them will have it around 28 to 30 days, but up to 35 days is okay. Up to 21 days is also okay.
Okay. So could you give a sense of like how what kind of mood changes that a person would go through during a cycle, essentially? Like what is normal to be expected and not get fettered about or
So
bothered
there is
about?
an entity called premenstrual syndrome. So that is because of a sharp dip in the hormone levels just prior to menses that most of the girls go through. Because of the decrease in hormone levels, they go through a lot of mood changes. Could be feeling low in mood, or episodes of depression in some of them, or some of them will be very anxious, irritability, getting anger very easily, abnormally reacting with people. In fact, many a times it is the husbands who come to my clinic who talk about their wives reacting abnormally, and they know for sure she's going to get her menses in the next few days. It'll become that predictable. Okay, so yeah, these are changes because of the dip in the hormone levels that happens just prior, can go on till the menstrual onset, and later on will subside.
Hmm. But this is completely normal to be expected. There's nothing to be treated in this, essentially.
The severe variety, yes, needs to be treated. Now, most importantly, it is to know that there is an entity like this which exists. So, on those few days, a woman or a girl should know that, see, these are the normal changes that I might go through. So, I might be a little more prepared on those days, avoid conflicts, or, know that if I behave like this, it is still normal of me. And people around her also should be a little more emotionally supportive to her on those days. And very severe varieties, yes, we do advise some amount of meditation, yoga, relaxation, and all that to help them. If that doesn't suffice, then yes, they will have to be put on hormonal medications to control this. But yes, definitely there is a solution. It is not that they have to live with it throughout. There are methods and ways to combat them as well.
So what might be confusing for some of our listeners would be, like at what point do I decide that okay, I should talk to a doctor about this? It's a little, you do expect that you will feel a little low, or you feel a little irritable, or whatever it is. You go through that cycle, right? But generally, what is the bar for you to think that okay, actually now I should maybe just discuss with a doctor, maybe I'm just going through too much of a swing here, or so
Yeah.
how would one discern that?
See, if it is just 1 or 2 days that you're going off in a month, it's still okay. But if it is disturbing your work schedule and your regular routines, or maybe your classes are getting hampered and you're not able to focus on your work, it is really disturbing your routine, then definitely you should seek help.
Hmm.
It need not be medical treatment at every visit. It could be just counseling, the way how you have to handle yourself on those days. Those things might help, or a few counseling sessions might help, or medications also will help.
You, in the onset of puberty section, we discussed like, only symptomatically you need to visit, or maybe for the
Mm-hmm.
vaccine, right? Is this now a good time to start a regular visit with the doctor, or much later in life, essentially for your
I would
health?
recommend one preconceptional visit for all women planning for pregnancy.
Okay.
And before that, many of them consider it a stigma going to the gynecologist, but I think they should withdraw off. I mean, it should be an open conversation, because many a times I see a lot of them coming to me late early 30s, or late 20s, saying that this is my first gynec visit, and they're so anxious in that visit.
Hmm.
They feel that
You
means to
just
say that,
visit in teenage years once to just break the taboo.
yeah. So they have this stigma that if you go to a gynecologist, you have some disease which is not to be expressed, so it is not something spoken about at home.
Hmm.
You can't openly say I went to a gynecologist. So you either have urinary infection or some pelvic infection for which you're consulting, which you can't that taboo should go. Only then those diseases will be effectively treated and cured.
So, talking about one of the issues at this stage now, like you said, you have seen cases of infections and otherwise where menstrual hygiene is an important piece, right? So, I just want to talk about in two stages of those, because there are a series of products now available in market to
Mm-hmm.
help with that. So, one is, of course, the pads, which has been the most advertised solution, but there are others, which is like tampons or menstrual cups or any of these, right? And then there is a lot of concern around whether these are safe to use, not safe to use. What is your view as a doctor on this?
The initial days we were talking about getting away from cloths being used. Then we would suggest, okay, please use pads. That is something which you're disposing of.
Hmm.
Off late, we are realizing that with pad usage also, you're keeping the moisture there for a long while, and that is inviting a lot of skin infections. So the best one to use during menses would be menstrual cups any day, because they're hygienic, they're eco-friendly, they're cost effective, will prevent the girl or the woman from a lot of infections.
Okay.
And
But because they're usable, isn't there a chance of infection?
no, 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 no,
No.
because they have to be sterilized and kept with minimal. I mean, it's not too much of a jargon to do it also. Simple boiling water and keeping it for 10-15 minutes in boiling water should sterilize it.
Okay.
And these are made of silicone materials, which are actually good to the skin. I mean, they'll not create any infections or irritation, are good in the long run as well.
Okay.
Tampons are a no-no, definitely. If you're using pads also, that should be something which you dispose of every 4 hours, and make sure it is not too wet and all of that.
Okay. And then there are other set of products outside which that have come into the market. Now there are a lot of uh, products called intimate hygiene wash, right?
Mm-hmm.
Then there are these new lotions that have come specifically for your private parts. So then there are these hair removal creams that have come. What's your view in regards to safety of these kind of products, essentially?
Intimate washes do maintain the pH of the private parts, actually. That prevents certain bacterial and fungal infections to some extent. The regular soaps that we use on our skin are harsh on the skin to the private parts. So, in that way, intimate washes are still recommended.
Okay.
Regular use also is recommended. But then I would not recommend other lotions and all that, because we have to see what the content is. And most often it's about minimally handling the area. The more you handle, the more you scrub, rub and all that, it will irritate you more. That is also there.
Okay. Um, so Another very frequently occurring this thing, and these are like varying conversation frequencies I've heard now. Like earlier, when I, 10 years ago, the number I heard was around 1 is 10, 1 out of 10. But now I hear some numbers like 1 in 5 women deal with PCOD,
Mm-hmm.
PCOS. So what is PCOD, and is it different from PCOS? Like what is exactly PCOD?
There's lots written about this PCOS and PCOD online also, because a lot of people ask me this question: is there a little difference? It is just like telling, no, I mean, what do you say? They're just almost the same.
Okay.
Okay. So polycystic ovarian syndrome is what we call. You have water-filled blebs in the ovaries, which cause hormonal imbalances, and that is why the effects. The incidence, roughly, like you said, is on the. It's. I would say it is on the rise. It was always there. Probably about 1 in 6 girls always had it. It was silent because many of them had age of marriage within 20, and they would complete their families by 25 earlier.
Okay.
Now you have a lot of them planning for marriage around 30, planning for pregnancy around 35 or past 35. So that is when you see these, and of course, the lifestyle that we have these days, more sedentary, so more incidence of obesity as well. So all this is adding on to resurgence of this disease. It is
A
not
lot of it
some.
is getting linked back to diet and exercise.
Yes. In fact, with polycystic ovaries, it's a vicious cycle. It is easy for you to put on weight with polycystic ovaries. I hear a lot of girls telling me, no, madam, I'm not eating much, I'm eating very little, but I'm still putting on weight.
Hmm.
And it will be very difficult for them to reduce weight as well. And every 2 kilos that you put on will make it easy for 2 more kilo weight again. And it becomes a vicious cycle. They keep putting on weight. And all the problems associated with polycystic ovaries again, starting with irregular menses, weight gain, and abnormal hair on the face, pimples, all that also increase. Once
Hmm.
they're putting on weight, these things also increase. Now, there's a very lesser variant of this called lean PCOS. Some of them are very thin and they have polycystic ovaries, but they have other symptoms as well, like pimples and all that.
Hmm.
They are lean, but they're still having polycystic ovaries. Yeah, so that way it becomes a little troublesome for young girls.
So, but one is weight gain and one is having pimples. But is there any? Is this something that just comes and just vanishes later in life, or is there a long-term effect of this? Like, what is the
No, it's
ultimate
a
effect of?
lifestyle disease. How I would describe this disease is like, you have hypertension, you have diabetes in people, and people live with it for decades together, right? How
Hmm.
do they do that? They initially do with diet, exercise. Later on, for some of them, we put medicines, insulin maybe, and they manage with it. They lead near normal lives for decades together. PCOD is a similar disease.
So there's a lot of chatter around PCOS actually not being treatable, and then there are a lot of herbal tea products to manage your PCOS and all. So one question I have is it only manageable with lifestyle, or is there a medical treatment for it? And two, I mean, are these herbal teas helpful in any ways to improve
Um,
this?
See, not all of them require medical treatment. So it's basically lifestyle management for polycystic ovaries, weight management, and diet primarily. So it is all about maintaining your weight in the normal BMI range. So everything else will fall into place. But certain women in that polycystic ovaries also do require medical treatment.
Hmm.
Now, some of them have higher insulin levels, what we call as insulin resistance. For them, they require metformin or other insulin sensitizers as treatment. Some of them will have other metabolic effects associated. Some of them could have even developed diabetes and all that. So those kind of patients do require medical management with medicines, but
Hmm.
otherwise primarily it is the lifestyle management. But talking about herbal teas and all that, I think they work more with respect to weight management itself, by basically increasing the basal metabolic rate or so. So in that way, again, it's the weight reduction and maintaining the weight which is what
It's
matters.
more a dietary and nutrition side
Yes,
of
definitely.
implementation. Okay. So is there some tests to kind of confirm the diagnosis of PCOD? Like, how do you diagnose it?
Polycystic ovaries
Because
is,
like in teenagers, anyone could get just pimples without having,
yeah, definitely,
right?
yes. So it is a clinical, biochemical, and ultrasound criteria. Three things that we look at to actually make a proper diagnosis. And once proper diagnosis is made, it will always be there. It will
Hmm.
not change.
Okay.
So clinical criteria would be that she has irregular menses, and or some of them will have very frequent menses. Some of them will have, menses once in 3 months, 4 months, kind of a thing. Or you can have excessive hair growth, pimples, weight gain, and obesity. These are the clinical criteria. And lab criteria, biochemical criteria, when we call it as the hormones that we check at, FSH LH ratio will be raised, and especially the LH hormone will be raised in some women. And then you have fasting insulin levels being raised. These are biochemical criteria. And on ultrasound, you see the typical water filled blebs
Hmm.
all over the ovary that you see numerous in number, bulky in size. Those kind of ovaries are very typical of polycystic ovaries.
So the we'll come back to PCOS and its effect on fertility, maybe later stage of life. But the other question, the last one for this stage is, a lot of young girls deal with periods that have very heavy flow and a lot of pain,
Hmm, hmm,
per
hmm.
se. What could be the reasons for these, and generally, like, what are the kind of remedies that women can employ for this, and when should they come to a doctor?
Yeah. So dysmenorrhea is what we call pain during menses. Now, it is common for young girls prior to a childbirth to have pain for 1 or 2 days during menses. It is normal. It is because the uterus canal would not have widened enough for the blood products to come out, for the menstrual fluid to come out. So when the uterus is contracting, it causes some amount of pain. That is normal. If they can manage with 1 or 2 painkiller tablets a month, then that is normal. But if a girl has to take
Like over the
off
counter painkiller.
over the counter painkillers, but if it is very severe, she has to take off from school or college, or she's not able to go to work on those days, or if it is associated with severe symptoms like nausea, vomiting, diarrhea, and all of that, then you should definitely seek medical help. What we do initially at first visit, we see if the symptoms are very severe, we do an ultrasound. Sometimes, very rarely, we see pelvic problems, pelvic pathology, what we call as, like, there could be fibroids in the uterus, which can cause this kind of pain, or other problems like pelvic infections, which could cause this kind of pain. Now, treating those can actually alleviate her pain. So, when should you see a doctor? When you are requiring more than 2 pills a month, or when you're required to take off from your routine just because of pain, then you must seek medical help.
Great. So now moving on from the teenage years to, like, young adulthood in 20s and early 30s, maybe, where women might actually be also be sexually active at that point in time, right? So a different kind of bunch of concerns
Mm.
start lining up around that time. One thing that is also increasing, uh, that we are seeing, is increase on in consumption of alcohol and smoking among women. The penetration of these products, right, is increasing. So is there any effect on the hormonal health of a woman with these products that is known, per se?
Um, Not on the hormonal levels, but then, yeah, general health does get disturbed a little more. See, now female livers are less tolerant to alcohol compared to men.
Hmm.
That is also there. See, the alcohol content. Now we see a lot of them taking it frequently, but they should know that the liver metabolism in females is a little more, lesser with compared to men. So the amount that the female liver can tolerate is also a little lesser. So these liver conditions like, liver cirrhosis and all that will set in a little earlier in females. And of course, smoking has its own hazards with respect to the lung complications that it can produce, or the effects, the general carcinogenic or the cancer inducing effects that it can produce. And similarly, it can also affect fertility, which is, I think, more of a concern of that age group. And during pregnancy, though, definitely it's a no no,
Hmm.
because it can have a direct impact on the fetus and the growing fetus as well.
Smoking also.
Smoking and alcohol both. We call it fetal alcohol syndrome. So the baby can develop abnormalities as well when the mother is taking alcohol during pregnancy.
So just going into the some of the further concerns of young women around sexual wellness, um, what are some of the advice that you would have for women to watch out for in general, right, when they
Hmm,
become
hmm.
sexually active? What should be, what should be there on the lookout for?
Yeah. So In the modern world, yeah, so you can't really restrict everybody from their sexual practices, but what you should know is hygienic practices are important. Protected intercourse is important. So, especially when you're going to have or multiple partners, um, using condoms around the intercourse episode is very important. So, persistent use, especially we see a lot of girls and youngsters these days, they after an episode of alcohol intake or when they're really really intoxicated, that is when they indulge in sex and they are totally off, so they don't know what has happened. So the next day they report to me in a state where they can't even recollect what exactly happened. So those are the kind of teenagers we're seeing these days, teenagers and early 20s girls we're seeing these days. So it is important to be a little more health conscious. Not that you should not indulge in it, but yeah, follow all the protective methods and then go through it. And then yes, also think about contraception. If you're in a regular relation or having frequent intercourse, then you should think about preventing a pregnancy as well, because any pregnancy, of course, we have medical termination methods which can make it safe, but anything will be can have an effect on the reproductive system and all that. So prevention is always better than cure.
Where talking about contraception, what's your view on the use of emergency contraception? Should they be taken OTC or should be taken within prescription? What's your view? Even though they are available OTC
Yeah,
essentially.
yeah. Actually, there's been a lot of abuse of the over-the-counter pills that way. But what many of them don't know is that the pill should be taken at the earliest, though it can be taken up to 7 to 2 hours after unprotected intercourse. It is to be taken at the earliest, as in the earlier you take, the better effect.
Hmm.
And these are commonly called eye pills
Hmm.
or the emergency pills that you would call. So they are known for a very high failure rate. Doesn't mean that okay, I took the pills, okay, I'm not going to have pregnancy. It's not like that. You should still watch out for missing periods and checking for your pregnancy test and all of that. It is known for high failure rate 1, and when it fails and pregnancy happens, most often we see pregnancy in the fallopian tube.
Hmm.
That is even more catastrophic. Pregnancy should normally happen inside the uterus. If it happens in the fallopian tube, then
It could be life threatening.
yes, it's called ectopic pregnancy and it has its own sequelae.
On contraception, just continuing the topic, right? There is an online trend right now of discussing contraceptions. One of the ways to do it is, of course, taking the emergency contraceptive, but the other way is to take the regular contraception pill, which is also becoming very common use in women, which is the birth control
Yeah, that is
pill.
more safer any day.
Yeah, but there is a lot of discussion around saying that okay, these pills have significant effect on the mental well-being of women. I mean, this is the conversation which is like the online social media as a buzz, where then like there are like women reporting saying that after I went off these pills, essentially, I feel much more better and more active and brighter, essentially, mentally. What are your thoughts on this? Like, is there an effect that has been
That's a
noted?
myth actually. Contraceptive pills, the regular birth control pills, you get them these days in very minimal dose. They have a lot of the side effects have been minimalized with these low dose pills, and they have a lot of beneficial effects
Hmm.
on the general health of the women. Now, earlier we spoke about premenstrual syndrome, right? Where the woman goes through mood swings and mood changes just prior to menses. All that is nullified when you take these pills. The cycle transition happens so smooth, she'll not even know that there is a change that is happening, and she's going to get menses and all that. So absolutely no mood swings, no premenstrual syndrome, and during menses she'll have significantly less blood flow, no cramps and all of that. Very good cycle control. If you have irregular cycles, it will completely normalize your cycles, and you're stress free. You don't have to worry about getting pregnant and all that. Very reliable contraception, and in the long run it will protect you against a lot of cancers, especially ovarian and uterine cancers. So in that way it is good for your bone and heart also in the long run. So it is known for a lot of beneficial effects
Wow,
in
it's
that way.
like
Hmm.
magic pill essentially. So the other side of the contraception is essentially discussing, the part of having, like, being sexually active and possibly having multiple partners is the potential risk of STIs.
Hmm.
So here is the question essentially, that like if you are sexually active, right? How frequently should you be getting tested for STIs? Should that be a concern for you, or should it be only on case to case basis where you're only worried about exposure, because if you have used contraception, you're safe? What's your view that youngsters should take on
See,
this?
one is about persistent use of protection. Barrier method should be followed with condoms, especially when it is
And when you say barrier method, condoms is one, but even diaphragm works
yes, does work.
for protection against STIs also.
Not as effective as condoms,
Okay.
definitely. So, but then yeah, it is about persistent use there.
So, going on the other side of contraception, right? Essentially thinking about, with being sexually more active by potentially having multiple partners, there is also worry about STIs, right? So, how should a young woman think about STIs? Just to bring some of this point, I heard, I might be wrong, is that actually you can have STI which is completely asymptomatic.
Hmm.
You might not even get to know essentially that you're this thing. So then, what is the approach should a youngster take to with regards to testing themselves on STIs, or how frequently should they think about addressing this issue? Uh,
One is about persistent use of condoms during intercourse, which will go a long way in protecting this. But yeah, in spite of that, see, we do see condom breaks and leaks and all of that, and you're still prone for infections. Most common infections would be urinary infection. Along with that, you will also have sexually transmitted infections like pelvic vaginal infections and all of that. So, if symptomatic, definitely you should seek help immediately. But otherwise, for someone having
what
multiple
would be common symptoms, just for the audience to know, like to
like
watch out
burning
for?
sensation during while passing urine, lower abdominal pain, discharge, foul smelling discharge, or itching in the private parts. All these are symptoms to watch out for.
Very easily confused with UTI kind of
Yeah,
symptoms.
yeah.
Okay.
And especially when you have multiple sexual partners, I would recommend getting tested at least every 6 months. Now, the question that you asked where it can be asymptomatic, especially about HIV infection, there is a window period before it actually shows up in your blood as well.
Hmm.
So, if you have an exposure yesterday and you come to me today, and if I check on you, I might not find an infection at all. It will actually show up after the window period. So, maybe three
Broadly,
to
what
six
this window
months.
period is? 6 months.
Yeah.
Okay.
So now there are certain infections like hepatitis B you can get vaccinated against, and hepatitis C virus, that is to some extent curable also. These days we have medicines against the virus, but HIV is not yet.
Hmm.
So that is something which can show up a little later. Now the other STIs, most often bacterial, fungal, they're all treatable. HIV is one thing which we are really worried about, which may show up a little later. So, if you've had multiple partners, I would recommend getting yourself tested once in 6 months at least.
Hmm. Fair. So, I mean, that was my next question actually, just to figure out that, to LA fairs, most of the STIs are treatable and it's not
Mm,
something
yeah,
to hide
yeah.
or, feel ashamed about it. I think the best course of action is actually to get out of your house and get to a doctor and
Yes,
get yourself
definitely.
treated.
Yes.
So, that is one thing. The other thing around
I
being
think the fear itself in the women that, I might be diagnosed with some infection which is not treatable
Hmm.
will hold them back. But the fact that, it is treatable, there is a solution to it. You just have to get yourself evaluated, will reduce that fear and will actually bring them to the gynec.
Yeah, and I think medication is also mostly affordable for
Yes,
these
definitely,
infections.
yes.
The other thing that is a side consequence of being sexually active is, potentially having a pregnancy that is unwanted pregnancy, essentially, right? So first, I mean, it's a sensitive topic, but having been in the digital world for some time, what we've seen is a lot of queries on happen on medical termination of pregnancies online because people are
Hmm.
scared of approaching doctors who might know family, right? So first, what does the law say? Indian law say about MTPs? Like when can you do it? When can you not do it? What is the rule book around this?
According to the law, any girl or a woman, if the termination is to happen, I mean, if it is an unwanted pregnancy because of a contraceptive failure, she can opt for termination. The other causes,
At any stage?
at up to 24 weeks.
That's the cutoff point in Indian
Yes,
law,
yes, yes,
essentially.
yes. Up to 20 weeks, one gynecologist can opine that yes, you can have. Up 20 to 24 weeks, it is two gynecologists that have to opine that yes, you can undergo termination. Now, other causes where it is allowed is when there is an abnormal baby, or when it has happened because of a rape, or if the woman is under serious stress or a medical disorder which does not allow her to be pregnant. I mean, it is life threatening to her to continue with pregnancy, then also termination is allowed. So, otherwise, if it is an unwanted pregnancy because of a contraception failure, then the law does allow it. By medical method, with just pills alone, it is approved up to 7 weeks. Or
Almost 2 months.
yeah, almost 2 months. After that, because of the amount of bleeding and the amount of failure rates that is there usually with advanced pregnancies, a surgical method would be recommended.
And what is the safest way about approaching this? Can an adult girl just walk into a hospital and request for it, or she needs to get a guardian along? What is the thing? Is she
If she is more than 18 years, only she could come and give the consent and undergo termination.
okay?
That is what the
that's
law
allowed.
also tells.
Okay, so that answers the questions that I have around this age group. So if you like the podcast, please hit the subscribe button or share it with someone whom you think will need it.